Welcome to the second part of my presentations. In this part, we are going to demonstrate the advantages of computer-guided implant surgery. There are many advantages for computer-guided implant surgery. Today, we are going to demonstrate some cases, some clinical cases that show these advantages. Of course, the first advantage is it allows the clinician to perform a safer flapless surgery. So this is a case for a 50-year-old male patient presented with multiple missing upper and lower teeth. As you can see, this is a lower jaw showing multiple missing teeth, and the same for the upper jaw. So we started the case by having a wax-up, and here we have a conventional wax-up, not a digital virtual plan of the future prosthesis. In this case, we had conventional wax-up. Then, using Implant software, we have imported the STL, which is representing the surface scan of the conventional wax-up of the patient. Then we blend the implant virtually according to the future prosthesis, and this is an axial cut showing the relation of the four implants to the buccolingual dimension or the buccolingual width of the jaw. So this is a printed surgical guide, and as you can see in this printed surgical guide, there are two holes for fixation, for extra fixations of the surgical guides using transmucosal screws. So this is a surgical guide which is fitted on teeth, and this is considered as a teeth-supported surgical guides. However, due to the long span of the edentulous space, we added extra fixation using two transmucosal screws. And this is we used here 1.5 by 10 millimeter transmucosal screws in order to provide extra retention and extra fixation for the surgical guides. So we started the drilling, and this case we have actually executed a partially guided protocol using Implant universal guided surgery kit. And in this case, in this slide, we are demonstrating the use of 3.2 diameter drill, which was the final drill before the last drill. And the last drill was done freehand. And although the last drill was done freehand, still we used the stopper of Zimmer from Zimmer kit. This stopper allows the surgeons to stop at the predetermined length of the osteotomy. And here we have inserted the implants freehand. So it is a partially guided protocol as the implant is placed freehand and the last drill was done freehand using the freehand kit. So 4 implants with healing abutments are placed. And this is 1 week post-op showing nicely healed keratinized mucosa. Actually, in this case, I was keen to measure the amount of deviations of the real surgery from the virtual plan. And as you can see here, in regard to the mesiodistal angle and the buccolingual angle, the slide on the left here, this is showing the virtual plan. So in the virtual plan, the angle is around 2 degrees, while in the real plan, the angle was 0, which means we had some sort of deviations which is around 2 degrees in a mesiodistal angle. However, in a buccolingual angulations, there was nearly no deviations between the virtual plan and the executed surgery. Another advantage for computer-guided implant surgery, it allows the clinicians to perform immediate temporizations. Immediate temporization using the surgical guide can be done in different ways. One way of doing immediate temporizations, this case is demonstrating one way of doing immediate temporizations. We had a 45-year-old lady presented with badly distracted tooth number 36 with a periapical pathology. So the patients, we decided with the patients to take the tooth out and remove or curate any pathology around the tooth and do some sort of socket preservation at this area. So this is tooth 16. Immediately after taking the tooth out and socket preservation. And as you can see in this cut, we have a sufficient width and length to place 4.7 by 10 millimeter implants. So we imported the patient STL and the patient CBCT merged together using Blue Sky Bio plan software. And this is the virtual plan of the future crown. And then we planned the implants. We plotted the surgical guides, and this is the surgical guides designed. And after that, we have created what we call it analog hole models. Analog hole models is a models with a hole at the site of future implant placement. This would send to the lab. So the lab would be inserting an implant analog in this hole and attaching the abutment and starting to fabricate the crown. The crown can be designed again digitally after scanning the model and then printed using some of the printing materials. NextDent is one option. It provides different shades, and in this case we use shade A3.5. So the temporary crown has been actually printed. When we come to the surgery, we had the crown in advance. So we executed the surgery, and this is a parallel bin demonstrating alignments of the implants with the remaining teeth in the edentulous space. And this is the final osteotomy, implant in place, removing the mounts, the implant mounts, and then the temporary prosthesis or the temporary crown, which is a screw-retained crown, is placed immediately and freed from occlusion. So this is a virtual plan using Blue Sky Plan software, and this is a periapical radiograph showing exactly the executed surgery. Another way of doing immediate temporization using the surgical guide is to do mock surgery. Doing mock surgery would require having a printed model and a printed surgical guide, and then placing the surgical guide on the model and starting drilling as if you are drilling inside the patient's mouth. By the end, you will have analog hole models that sent to the lab, and the lab is going to insert the implant analog, fabricates the crown, which would be a screw-retained crown, and be used immediately after surgery. The third advantage of the use of computer-guided surgery is you can do some sort of sinus grafting using the surgical guide. Let us see how can we do this. This is an intraoral photo for a patient who has a missing upper right posterior teeth distal to the first premolar. So the virtual plan shows that we can place two implants, one at site 1.5 and one at site 1.7. However, at site 1.7, the patients would require sinus graft in order to place implant at site 1.7. If you are doing the sinus lift and the bone graft in two stages, which means you are placing the bone and later on, after say 6 months, you are opening again and placing the implant, in some cases you might not be able to achieve 100% alignments between the future implants and the bone graft. This might be due to that the bone graft has placed away of the future implant site, and the future implant site, as we have seen on the first part, should be based on the virtual crown. So how to incorporate the sinus lift surgery within the prosthetic plan? This can be done by having a surgical guide that guide you in positioning of the bone graft in relation to the future implant location, which is based on the future crown. So this surgical guide could have a little window on the flanges of the guide. This little window can help the clinicians in doing the osteotomy at the lateral sides, and at the same time the sleeve of the implants could guide exactly where the future implants would be. So the bone graft would be exactly aligned 100% with the future implants placement. In this case, I have done an implant placement with simultaneous sinus graft, so the problem was not there. However, the surgical guides actually helped me in defining where exactly the lateral window should be. So this is the lateral window, and after that we take the surgical guide away and we continue the sinus lift surgery as usual. So this is the osteotomy and the two parallel bins and then the bone graft. And the sequence of events here is you do the sinus lift and then you do the osteotomy, then you place the bone graft and then you place the implants. And in this case I prefer to have a primary closure in order to keep the implants in safe during the healing process. And this is around 1 month post-operative. So this is 6 months post-op CBCT showing a complete alignment between the implants and the bone graft in a buccolingual and mesiodistal dimensions. In this slide I have merged the pre-operative visual plan and the post-operative CBCT in order to see the amount of deviations. The white color representing the visual plan, while the red color representing the real implementation of the surgery. As you can see here that there is some sort of deviations between the visual plan and the surgery. The linear distance of deviation at site 1.5, it's around 0.46, while at site 1.7 it is 1.6 millimeter. One of the advantages of computer-guided surgery is when you have a surgical guide, this surgical guide can dictate the amount and the site of bone grafting, especially if you are doing a fully reconstructive bone grafting from an iliac crest to the upper and lower jaw. In the next case, we will show how the surgical guides can help and the clinicians in performing surgery while putting in his mind the future prosthetic plan. So this is for a 60-year-old patient presented with lack of bone width and height of the upper and lower jaw. A prosthetic-driven treatment plan leading to the fabrications of a surgical guide. The surgical guide involves holes to gain sleeves as usual, and the guide is a bone-supported guide and displaced and fixed in place inside the patient mouse inside the surgery. And the guide in this case gives an indication about the future implant sites. So bone graft is harvested from iliac crest and fixed by screws in the appropriate sites based on the future prosthetic plan. The width of the ridge is checked against the direction of the hole to confirm that is sufficient width for future implant placements is achieved. Then 6 months later, another bone-supported surgical guide is planned based on the new achieved width. And one of the questions that can arise here, why the old guide would not be used. Actually, as all of us know that bone remodeling is unpredictable. So it is important to base implant placements on a new guide that is constructed based on a new CBCT for the patients after healing. And in this case, we have waited 6 months before placing implants. And in this case, we are actually following the dual scan protocol, so scanning the patients with the denture and then scanning the denture separate. Then using Implant software, we have merged both scans in order to implement a prosthetic-driven treatment plan. So this is a bone-supported guide that is designed and then exported for printing. And the patient's going to receive 8 implants in the upper jaw and 6 implants on the lower jaw. This is 6 months post-operative. We started by crestal incision to take off the fixation screws and fix the surgical guides. And as you can see, the healed bone with some degree of resorption around the fixation screws. Then the surgical guide is fixed in place using bone screws. Soft tissue is retracted using 3/0 Vickel sutures. Then implant osteotomy is performed using Implant universal drilling kit. And the final osteotomy is made using the BioHorizon freehand kit. 8 tapered BioHorizon implants are inserted in place. The lower arch is performed in the same way, and again a bone-supported guide is fixed in place. And note in this case the last sleeves on the right and the last sleeve on the left, we had a sleeve with a buccal opening. This sleeve allows the placement of the drilling, especially in cases with limitation and mouth opening. Drilling was performed using a universal Implant kit, so 6 osteotomies before finalizing the drilling freehand using bi-horizon freehand implant kit. This is the final osteotomies, and then 6 implants are in place. So this is a patient's postoperative OBG showing an excellent alignment between the placed implants in the upper and lower jaw. By the end of this case, we have shown you some of the advantages of computer-guided implant surgery. The surgical guides can help the clinicians in performing a safer flapless surgery. It can guide the surgeons in placing the implants that is in the proper positions based on the future procedures. It can help him in performing an immediate temporizations. Also, it can guide the surgeons to the future place of the implants while he's performing a sinus lift or reconstructive bone grafting surgery. Thanks very much for your attention, and let us now move to the third part of the presentation, which is about limitations and complications of computer-guided implant surgery.